My second, amazing also transformer, Sylvana. Sylvana, she's the founder of the CEO of Praava Health in Bangladesh, and she has brick and click healthcare platform that combine digital tools with meaningful doctor-patient relationships. I love that type of terminology. And she always empowering also women and the whole quality diagnostic in the whole Bangladesh. I'm happy to see you here face to face, and you have 5 minutes. Please let us know about who you are and your innovation. Take the floor.
Thank you so much. Thank you so much, Dr. Hyatt, and it's really an honor to be here. I feel really privileged to be representing my team in Bangladesh in front of all of you. We're really excited. So I don't know how to get my, do I put the presentation up? Or, oh, great. So Praava is Bangladesh's fastest growing consumer healthcare brand. I'm not sure how much all of you know about the country of Bangladesh. It's a country of 170 million people, and also happens to be one of the fastest growing economies in the world, growing at 8%, 7 to 8% consistently pre-COVID. Even in 2020, grew 4% against the backdrop of the global recession. And the health sector is growing even faster than the economy, at 11% CAGR over the last 15 years. Per capita health spending is expected to 5x in the next 20 years. And what we're seeing is that there's tremendous excess demand in the market for high quality healthcare services. There's a huge gap in terms of the demand and the supply. The average amount of time doctors are spending with patients is 48 seconds. There's only one internationally accredited lab in the country, and there are 10 to 15% of drugs in the market that are counterfeit. So we have a big need to fill, and there are a lot of people who are approaching the problem of healthcare from many different angles. We heard about a really interesting technology solution, and there are many different approaches that we can and should all take. Praava has integrated technology and infrastructure meaningfully to own the entire outpatient healthcare experience. And it was always really critical to me that this intervention was underpinned by quality infrastructure, because what we see across low and middle income countries is that more people are dying due to lack of access to quality healthcare than lack of access alone. So, what we're seeing globally is that care is shifting from hospitals and into clinics and into homes. But unfortunately, across emerging markets, what we're still seeing is largely hospital-first care. People are going directly to hospitals anytime anything goes wrong. So what we're trying to do with our brick and click model is create an integrated outpatient solution that is every patient's first call. You can see on the screen here, on the left side of the screen, you can see a photograph of our flagship hub clinic, which is a 10-story building in downtown Dhaka, Bangladesh's capital, as well as our app, which is the first patient app in the country. Our care consists of consultations with family doctors, as well as advanced specialties. We do outpatient procedures. We have a lab that's set up according to international standards of the College of American Pathology, fully integrated lab, full range of imaging services, as well as in-house pharmacy that sources directly from manufacturers to eliminate the risk of counterfeit drugs. Everything is underpinned by technology. We've brought Bangladesh's first fully integrated hospital information system, which features the first patient app in the country that I mentioned. Includes medical records, appointment bookings, as well as digital products, which mostly we rolled out during COVID, actually, including telemedicine, e-pharmacy, and virtual primary care. We started serving patients we had our ribbon cutting of our 4-year anniversary, actually, just last week, but we officially launched in February of 2018, so we've been serving patients for nearly 4 years now. The COVID pandemic really accelerated our growth. We've now served more than 225,000 patients in Bangladesh, growing an average of 20% month on month. And COVID really accelerated that growth and gave us an opportunity to serve the community during this massive public health crisis that we're all living through. In addition, it allowed us to accelerate and prepone the product launch of digital products that I mentioned, such as telemedicine, e-pharmacy, as well as virtual primary care. We built a tool for remote management of COVID. And it's our belief that models like ours that combine technology and infrastructure are not only going to continue to play a pivotal role in actually addressing the pandemic as it persists, as we see vaccine inequity. We're going to continue to see low and middle income countries dealing with the pandemic. But these types of models will also help us to prevent future public health crises. And so, we're really grateful to the Transform Fund for its investment, which is basically allowing us to, for its investment, which is basically allowing us to accelerate the growth of our model. We'd like to build out our hub and spoke model in Dhaka, which is the capital, in the coming years, as well as accelerate the launch of a patient super app, which would be a one-stop shop for all of your healthcare needs in an outpatient setting. We've started our journey in Bangladesh, the 8th most populous country in the world, but we believe our model is scalable across emerging markets, where, as this audience knows all too well, more than 85% of the world lives. Demand for healthcare services is growing in these markets, and what we've seen from an impact perspective, McKinsey estimates that for every dollar that's invested in healthcare infrastructure, you get more than a 4x return. So the financial and impact opportunity is really substantial. We're so thrilled to be here, Dr. Sindhi, and really excited to partner with the Islamic Development Bank in facing these challenges.
Is she amazing? Yes. Sylvana, one of your slides you mentioned you would like, this is not only for Bangladesh, the technology you want to expand. So tell us about your, in a few minutes or 1 minute, you plan, how you're going to work with different stakeholders, and if you want to expand different country, what is your plan to go forward, and how are you going to take it from Bangladesh, for example, let's say Pakistan, or bring it to Senegal, or?
Well, inshallah, with ISDB support, we can take it everywhere. For the near term, we're definitely very focused on Bangladesh. As I mentioned, it's a country of 170 million people, and we'd really like to prove out the model in Bangladesh. But I think in terms of some of the technology pieces that we're working on, in particular things like virtual primary care, I mentioned a tool that we developed that's shown initial results to reduce hospitalization rates for COVID patients. That has future applications to chronic disease, and I think those types of interventions can easily be scaled to other markets, and we're really excited to get started on that in advance of investing in infrastructure in other markets.